Let's talk about Ukraine. The health system there is facing its darkest days in the war so far. That is the warning from the World Health Organization after Russia targeted the country's infrastructure, leaving millions of people without electricity, heating or water. Well, let's go live to the capital now. Our correspondent Hugo Bishega is there for us again today. Hugo, good to see you. So it would seem the attacks is relentless right now. The temperatures are below freezing. How worried are the authorities about the impact this is having on people's health?
Well, Sally, the authorities are concerned because for weeks we've been talking about these Russian attacks targeting this country's electricity infrastructure, critical infrastructure, and millions of people across the country are facing very difficult conditions without power, without heating, and in some places even without water. And temperatures have fallen to below 0 degrees Celsius across the country. It has been snowing here in Kyiv and in other areas of the country in the last few days. It is minus 3 degrees Celsius now here in Kyiv. So that gives you a sense of how difficult the next few months will be. So I asked the health minister here, Viktor Liashko, about how the authorities are preparing the health system as winter sets in. And this is what he had to say. Take a listen.
Це дійсно так. Українська система охорони здоров'я переживає черговий виклик.
That's right. The Ukrainian healthcare system is facing a new challenge as a result of the full-scale Russian invasion of Ukraine. Since the beginning of the war, we've suffered as Russia shelled civilians indiscriminately and attacked hospitals. Already more than 1,100 healthcare facilities have been damaged and 144 completely destroyed. And now, on top of that, we face strikes on our energy infrastructure.
До цих проблем додаються зараз ще питання і енергетичні.
But are you concerned that this country may face a humanitarian crisis if these attacks don't stop?
Ризики завжди високі, і потрібно готуватися до найгірших ситуацій.
The risks are always high. We have to prepare for the worst situations. This is what we do. I ask our international partners to support our hospitals with generators, with heating systems, so that hospitals can continue to function in the event of a blackout.
What is the advice you're giving to hospitals across the country?
Перше, це те, що ми комунікуємо, бути готові до того, що може бути відключення.
First of all, we've warned them to prepare for the possibility of power outages, no heating. There could be no water supply and no functioning sewage system. We have developed different plans for these scenarios. We've already told hospitals to limit the number of patients admitted for planned treatment and surgery.
Госпіталізацій і планових оперативних втручань. Тобто робиться пріоритет на ургенцію і на те, що
We are prioritizing emergencies, trauma injuries, anything related to the war. We understand the consequences. We understand that the war will have an indirect impact on the health of Ukrainians, which may not be noticeable right now.
That was the Ukrainian health minister, Viktor Liashko, and he mentioned that hundreds of health facilities have been damaged, have been hit as a result of these Russian attacks. And later today in Paris, an international conference will be discussing how to help Ukraine, but also how to help Ukraine rebuild its infrastructure, not only hospitals, but also schools and the electricity infrastructure that's been consistently targeted by Russia in the last few weeks.
Okay, Hugo, for now, thank you. Hugo Bishega there in Kyiv for us.